All right, good morning, Mr. Hughes. How are you today?
I'm good.
I've heard some exciting news. You're getting to go home today. Before we let you go, I wanted to talk to you about your hospital stay and your diagnosis while you were here. You were diagnosed with primary hypertension, which probably basically to you means high blood pressure. I'm sure that you've heard of people or know people who've been diagnosed with this before, and while it's very common, if it's left untreated, it can cause you some serious consequences such as heart attack or stroke, and we don't want that to happen. While we don't know the exact cause of high blood pressure, we do know that when blood pressure is high, the force on the walls of your arteries is increased, and that can be really damaging to your arteries. This also causes your heart to pump harder against the pressure. So while we don't know the cause, we do know that certain things can be risk factors. Your age, smoking, and stress all put you at higher risk for this disease. While we can't do much about your age, I'd be happy to talk with you about stopping smoking or about stress management if those are things that you would like information about. There are also things that you can do to improve your risk for serious consequences from high blood pressure. Your doctor's prescribed valsartan, which is a medication that's designed to help you manage your condition. It belongs to a class of drugs known as angiotensin II receptor blockers. Angiotensin II is a substance in your body that causes your blood vessels to constrict, and when this medicine blocks that constriction, it causes your blood vessels to relax and the blood can flow freer so it doesn't damage your arteries and your heart doesn't have to pump as hard. Now, before we go any further, I need to confirm with you that you don't have any kidney or liver issues.
No.
Okay, that's great news. So this medicine isn't always the best choice for people with existing kidney or liver problems, but it sounds like we're okay. The doctors prescribe this medicine in a low starting dose that you're going to take twice each day. It's always best to take those medicines at the same time each day if you can. After a couple of weeks, the doctor would like to see you to monitor how you're doing and will likely increase your dose to a more therapeutic level. It's great if you can monitor your blood pressure at home, but if you can't, it's not a big deal. The doctor will be monitoring you closely to make sure your blood pressure is coming down and to make sure that you're tolerating the medicine well. But there are a couple of things we need to watch for. While this medicine is usually really well tolerated, it can cause angioedema, which is just swelling of your face and hands. If you notice this, you're going to contact your doctor right away. Also, if you notice any kidney issues, you're going to want to contact him as well. Your doctor is going to monitor you for blood pressure, kidney function, and liver function while you're on this medicine. If you have any questions at all, anytime during this time, please feel free to call your physician's office. Now, I know that's a lot of information at one time. Do you have any questions that you'd like to ask me?
No, not right now.
All right, is there any other information I can give you, like smoking cessation information or stress management resources?
No, not right now, but maybe in the future.
All right, that sounds great. Just to make sure that we're all on the same page, can you tell me what your plan is for when you get home?
Just to hang out? I don't know.
That's good. You're going to take your medicines, monitor your blood pressure if you can, and see your doctor on a regular basis. That's your 3 roles in this. Does that sound good to you?
Sounds good.
All right, that's great. It's been a pleasure taking care of you while you're here, Mr. Hughes.
Thank you.